Welcome, and thank you all for joining us today. I'm Ramsey Alwyn, President and CEO of the National Council on Aging, and I am thrilled to have you here with us today during Medicare open enrollment. We're gathered to discuss the critical work that's helping people in your district navigate the complexity of Medicare open enrollment, which runs through December 7th. Open enrollment is such an important opportunity for people to make sure they're in the best Medicare plan for their needs and they're making the best use of their limited resources. It's also a time for older adults with lower incomes to make sure they're getting all the help they qualify for as they navigate their healthcare needs. And we know that many congressional offices can receive calls from constituents asking for help with Medicare. So our goal today is to connect you with a fabulous network of state and community-based organizations that are there to help serve people back home and to help you. Because let's face it, Medicare is complicated. It can be expensive for those who are struggling to afford doctor's visits and prescription drugs. Medicare premiums and coinsurance can add up, and it can be particularly challenging for people who are living on a fixed income or a low income, like individuals with income below $22,000 and non-housing assets below $16,000. The good news is there are programs there to help, programs to help low-income people pay for Medicare. They include the Medicare Savings Program, or MSP, which helps pay for Part B premiums and coinsurance. And then there's the Medicare Low Income Subsidy, or LIS, which helps pay for prescription drug coverage. Important programs that can have a profound effect on those who are struggling to afford care, and they can save hundreds of dollars. Yet so many individuals that are eligible, they're not enrolled. And often that's because they simply don't know the programs exist or how to apply. The federally funded community-based network we're talking about today is working to close that enrollment gap. There is federal funding that includes $50 million a year to support the work of a network of organizations and committed individuals. There are the state Health Insurance Assistance Programs, or SHIPs. There are area agencies on aging, or as we refer to them as AAAs. There are Aging and Disability Resource Centers, or ADRCs. And there are 87 Benefit Enrollment Centers, or BECs, in 38 states available to help. The mission of these local organizations is simple. Find people on Medicare who are already eligible for low-income benefits, including the Medicare Savings Program, or MSP, and the Low-Income Subsidy, or LIS, and get them enrolled, get them the benefits they need. That means they're helping hard-to-reach individuals, particularly people in rural areas, get connected and get enrolled. We've seen that benefits outreach and enrollment works and makes a big difference in the lives of individuals. Over the past 16 years, enrollment in the Medicare Savings Program has doubled. And in the last 2 years alone, the network has connected an eye-popping 9.3 million low-income Medicare beneficiaries to these programs that can help. Federal funding for this work is critical. It's been extended 12 times with bipartisan support. But now we're facing a critical deadline. Funding for this work is currently set to expire on December 31st. We'll share more about that later. But today, you'll hear from professionals who are working within this network, as well as a fellow staffer on Capitol Hill. You'll see we have a great lineup of speakers sharing the federal, state, and local perspective. And I'll introduce each as we go through the program. But first, I want to start with Shirley Donay. Shirley is a 74-year-old resident of Rochester, New York. She did everything right, everything that we're told to do to prepare for a secure retirement. She had a successful career as a sign language interpreter, and she saved for her life after work. But even she found herself in need of help. Let's hear her story.
Hi, my name is Shirley Story. I'm 74 years old and I live in Rochester, New York. And I am here today to speak about several items: the Medicare Savings Program, for one thing, and the Lifespan Agency that has held my hand through a very large crisis. I was set to retire. I worked at Rochester Institute of Technology and as a sign language interpreter for 50 years, but at Rochester Institute of Technology for 31. And I had a really nice retirement from RIT, and I had financial advisors who kept me in monthly income and kept growing my income that was in CDs and stocks and bonds. And then at the end of June and the month of July, I was scammed of every cent of my retirement money. A lot of self-loathing, but I got over that in 2 weeks because I realized if I didn't get over it, I would be living in darkness for the rest of my life. Or I had also considered taking my life initially when this happened. I couldn't believe it, but I got over that pretty quick. And I'm looking at this as a new path in my life. The scam was horrible. I totally fell for it. I know I'm one of millions. They were very smooth. I won't go into details, but basically I gave them every cent that I had in my CDs and stocks and bonds. So now I'm living on Social Security. I didn't know what to do. I am a person who has my glass half full, and this emptied my glass and all the other ones in the cupboard. So I needed to do something to make my life better. I didn't anticipate this at 73 when it happened. This was not how I wanted to spend the rest of my life, living on a shoestring budget. So the first thing I did was to reach out to Lifespan, which is a phenomenal agency in Rochester, New York. I worked there as they had an interpreter referral service, and I was a sign language interpreter. And I worked for their agency as an interpreter and also as an office assistant. And I had also done some workshops in the past with them. And I was just generally, I knew about the organization. I have a certificate in gerontology from Lifespan and St. John Fisher University. I was always interested in aging, and now it's me who is aging and in need of services. So I knew where to go. I just didn't know how phenomenal their services were going to be. One of the things that I applied for was the Medical Savings Program. The MSP. Through this program, I was able to get the money that I was paying for my health insurance and my prescription taken out of which was taken out of my Social Security, and that was now returned to the monthly amount that I received. It was about an extra $200 a month, which when you are only bringing in $1,300, $200 is a very large chunk of change. So my income went to $1,500 a month, and that allowed me to buy more groceries, hearing aid batteries, my inhaler because I have asthma. I mean, it just really gave me a cushion that I didn't anticipate. And this is one of the many, many things that I applied for with Lifespan's help. I honestly was a lost soul when I was scammed, and that's not me. So Lisa, my case manager, held my hand through this whole thing. She was always there, whether it was phone or text or in person. She was just phenomenal helping me. I'm going to read the list of the services I applied for through Lisa through Lifespan. I applied for the MSP. I applied for SNAP. I was given $23 a month for groceries. And although that doesn't seem like a very large amount, it helped me to be able to buy hearing aid batteries and those kinds of things. So I applied for the MSP program, SNAP, subsidized housing, which I'm now living in. I really was fortunate in finding a place quickly that I like. I will be getting the low income subsidy for Part D on Medicare. I got into a food cupboard. I got U of R financial assistance, which basically excused my bills. I applied for EPIC and Medicaid. Of all those 8 services I've mentioned, I have already received 6, which I find phenomenal because usually, it's a bureaucratic agency and it takes months to get through it. No, it was only a couple months. I was receiving all these acceptances that I had received. I was amazed. The only ones I haven't received yet are the low income subsidy for Part D and Medicaid. Out of 8, that says something. And I would not have been able to do that without Lifespan because I would not have known where to go, what to do, what services were available. I was basically clueless about this area. What I really want to say, the most important thing I want to say to Congress and anyone else who may be watching this is the huge importance of programs that were available to me that I applied for, like the Medicare Savings Program, SNAP, and all those programs. I would not have known what I was eligible for, where to go. Lifespan is one-stop shopping for people who are aging, and I believe that their limit is 55 and over. It's phenomenal. It really, having an organization that you can go to get all your needs met when you are in crisis, big time crisis, has been amazing. And I will forever be grateful to Lifespan and the programs and the services I've received. Thank you for listening.
And we are so grateful to Shirley for sharing her story. She's a powerful testament to why these programs and this work we're talking about today are so critically important. Our economic well-being can be tenuous, and unexpected turns can happen to anyone. We must make sure there's the right support in place for all of us when we need it. Now I'd like to introduce our first speaker of the day, who's doing just that in his home state of Missouri. Scott Mina is director of the Missouri State Health Insurance Assistance Program, or SHIP, as we like to call them, and he's also the chair of the SHIP Steering Committee. Welcome and thank you, Scott.
Thank you, Ramsey. Good afternoon, everyone. The State Health Insurance Assistance Program, or SHIP as we are known, is a national network of 54 programs that assist Americans with Medicare. As the National SHIP Steering Committee Chair, it's my honor to represent these 54 SHIP programs today. SHIP services are unique in their unbiased and free nature. They're a valuable resource for Americans. Our counseling and education efforts on Medicare empower individuals and their families and caregivers to make informed decisions about their Medicare benefits. We assist many in enrolling in programs that suit their specific needs. We don't sell anything, and we don't steer clients to any one type of coverage or provider. We are a trusted resource. We help folks navigate Medicare. Our program is made possible by funding from the Administration for Community Living, which is a part of HHS. MIPA funds help us to reach hard-to-reach individuals where they are. We work with very rural beneficiaries. We work with folks who speak English as a second language. And crucially, we provide a lifeline to the lowest income Medicare recipients. Our policy is to screen every Missourian we meet to determine whether they are eligible for programs that can help them manage their Medicare costs. We teach them about the low-income subsidy or extra help, a program to help them afford their Medicare Part D coverage by covering deductibles and copays depending on their income and resources. And we help them enroll. We make them aware that the Medicare savings programs can help cover the cost of Medicare Part A if they have that, and Part B premiums if they meet the guidelines. The assistance we provide can make the difference between an elderly widow having to decide between paying her power bill in the winter or filling her prescription for her heart or diabetes medications. No one should have to make a choice like that. This work is needed, it's important, and it should be funded adequately and permanently to empower the Aging and Disability Network, including the SHIPs and the AAAs, to help Americans with some of the most dire challenges. During open enrollment for Medicare, which is right now, we have documented thousands in savings by helping Missourians compare their options and understand the differences in cost and coverage, but also to ensure that they enroll in any savings programs that they're eligible for. Often they don't know these programs exist. Low income benefits outreach, the work that is made possible by MIPA funding, is crucial. Thank you for listening.
Thank you, Scott, for your incredible work. We appreciate your leadership. Our next speaker is Jamie Alexie. Jamie is the Community Services Director for the Eastern Area Agency on Aging in Maine. Jamie's AAA, as we like to call them, serves as a benefits enrollment center as well. Welcome and thank you, Jamie.
Thank you for that introduction, Ramsey. Good afternoon, everyone. It's an honor to take the next few minutes and discuss such an important topic and for some a life-changing benefit. Benefit enrollment centers play a critical role within their community. At Eastern Area Agency on Aging, our coverage area is about 13,000 square miles, with many towns being rural, and 2 out of our 4 counties that we cover have almost a 20% poverty rate. In addition to these statistics, Maine has the highest percentage of people aged 65 and older in the U.S. Therefore, as a benefits enrollment center, we understand how paramount it is to play an active role in our community. BECs and here at Eastern, we provide assistance and education on various programs to a variety of people. Our resource team each year fields about 12,000 calls, emails, and walk-ins from individuals who are seeking out more information on resources and assistance to apply for programs that we provide and accessing resources within their community. In many instances, people are unaware of what they could qualify for. And as we start to obtain their demographic information, it absolutely opens the door to educate them on their options and start to screen them for eligibility. For example, people who call us wanting to learn more about the Commodity Supplemental Food Program may be unaware of the Medicare Savings Program and vice versa. It's also important to recognize that benefit enrollment centers partner with various local agencies in order to build on resources instead of duplicating them. Educating our consumers and assisting them with the application process are ways we help put money back in people's pockets, and they're able to stretch their dollar even further. Next slide, please. An agency that is present in their community that provides advocacy, support, evaluates each individual situation, and assists with challenging decisions can bring people invaluable peace of mind, purpose, and direction. It reassures people that they are not navigating their journey alone. Over the years, we have heard countless stories of how people cannot afford their Medicare premiums on their limited income. They may be facing a lien on their home, or they can't afford their prescription medications, or even struggling to heat their home during the long, cold winter months. One particular story of how this program deeply impacts people is back in July of this year. One of our Medicare counselors screened a consumer for eligibility for the Medicare Savings Program and identified that the consumer would qualify for Quimby, covering his Medicare medical copays and coinsurances. The Medicare counselor assisted the consumer in completing an MSP application and faxed it to the department on the consumer's behalf. Once the consumer was officially enrolled onto the Quimby program, he returned for a follow-up meeting to review his prescription drug coverage options. Using Medicare.gov's Plan Finder, the Medicare counselor entered the consumer's medications, 2 of which we found are very expensive, and searched for prescription drug options that covered all of the consumer's medications and included his in-network preferred pharmacy. The consumer opted to enroll in the least expensive Part D plan, and in combination with his Quimby enrollment, would save him an estimated $15,000 each month. That story in and of itself should resonate with all of you, and how continued funding for MEPA is absolutely crucial for people. I would say that that is a little bit of a higher amount than what we normally see, but for this person, it was truly the difference between being able to take his medications or not. We see people all the time who are on expensive medications for a variety of reasons, and not all of their meds provide a generic option. And I know that there are many more of these same stories throughout not only the state of Maine, where I'm from, but throughout the country. People's lives depend on this program, and without it, people will struggle to meet their basic needs, decreasing their quality of life. Thank you, everyone. And now I will hand this back over to Ramsey.
Well, thank you, Jamie. That was a really powerful illustration of the importance of this work and what it means in the real lives of Medicare beneficiaries. Our final speaker today is Lindsay Martin, Constituent Services Director for Senator Bob Casey of Pennsylvania. Welcome, Lindsay, and thank you.
Hi, thank you so much, Ramsey, and thank you to the National Council on Aging for hosting this briefing. My name is Lindsay Martin, and I am the Director of Constituent Services for Senator Bob Casey of Pennsylvania. I've worked for Senator Casey for over 8 years, always within the realm of constituent services. I'm based in the Senator's Harrisburg, Pennsylvania office, the state capital. We're about 2.5 hours north of DC. Pennsylvania, we're a larger state with about 13 million people, and we have 52 area agency on aging, AAAs, that cover all 67 counties. Normally on webinars, I have to explain what constituent services is and the various ways that congressional offices can assist constituents. Those of you on this call already know what we can do, and how your senator or congressperson and your team help people with these issues when they reach out. What LAs and LCs on this call might not know is that when you refer your constituents to one of your caseworker or constituent advocate colleagues about a Medicare, aging, or healthcare issue, and you ask your colleague if they can assist the person or give them resources, programs funded by MIPA are those main resources. They're local for your constituents, and they provide free, unbiased help. I think the best way to hammer home how useful these services are is by providing actual examples. So I'm going to give a couple of scenarios each of your offices have absolutely been contacted about by constituents. The first is that, as we all know, it is Medicare open enrollment from October 15th through December 7th. So you can change, add, drop a Medicare Advantage Part C or Medicare Prescription Drug Part D plan. Congressional offices can help with a lot, but we're not able to assist constituents who contact us with actually comparing the different plans offered in a particular geographic area based on cost and coverage, and advise that person on choosing the best plan for their needs and then helping them actually enroll. But your state health insurance programs, SHIPs, can do that. And your office can direct or connect the constituent with that service. The information is going to be unbiased, unlike if the constituent goes to a broker who works for a specific insurance company, and it's going to be free. The SHIPs can also help answer questions that constituents have about Medicare changes year to year. As we know, in 2025, thanks to the IRA, we're going to see the implementation of the $2,000 out-of-pocket prescription drug cap and the Medicare prescription payment plan. Another example, every office in this webinar has received calls and outreach from seniors who are having difficulties affording their prescriptions. These are really tough conversations, and your constituents are reaching out in a really vulnerable and difficult situation. AAA, SHIPs, BECs, they can help constituents navigate programs like extra help for Medicare prescription costs, Medicare savings programs, or they can even see if maybe a better Part D plan meets the needs for the person if it's open enrollment. The last example I'll give, but by no means exhaustive of the ways that AAAs, CHIPs, ADRCs, and BECs help constituents, are for folks who are dual Medicare and Medicaid eligible, like Shirley, who we heard from earlier. Or maybe they're losing their Medicaid eligibility because their cost of living adjustment for Social Security puts them just over the income limit. Getting a few additional dollars per month is by no means going to offset the increase that person will see in their healthcare costs that comes from losing Medicaid. But the services provided by MIPA, they can talk with the constituent about their specific situation and income and see if they qualify for extra help for prescriptions or maybe a Medicare savings program like a qualified Medicare beneficiary or qualifying individual. These are the various types of programs that help constituents pay for the Part B premium or even their copay and deductibles and coinsurance. The final topic that I want to touch on and hopefully encourage your offices to do, if you're not already, is to proactively reach out and get to know your AAAs, your SHIPs, your BECs, if you have them in your state. In addition to referring constituents to them for assistance, you can develop a two-way partnership to best serve your constituents. So, for example, in Pennsylvania, our SHIP programs are called PA Medicare Education and Decision Insight, or PA Medi for short. So each AAA has a PA Medi volunteers and staff, and they in turn are overseen by regional PA Medi coordinators who we have built relationships with. So not only do we refer constituents to their services, they'll sometimes reach out to our office with cases when they're trying to help beneficiaries but are running into problems. So we've had cases referred where they connect us with constituents they've been trying to help with Medicare enrollment issues through Social Security or issues with Part B premiums. Other ways you can partner are by doing events or webinars to highlight the services and programs that these services offer. For example, last month we did one with PA Medi, where we hosted a bilingual event in Harrisburg at a local Latino center to help seniors on Medicare who may not be comfortable speaking English, especially speaking English, as a second language about something as complicated and important as Medicare. And so we held this so they could learn about the help available through PA Medi. So again, building these partnerships can help your offices meet your constituents where they are and make sure that they're aware of and accessing necessary services that they might be eligible for. The running theme I've been talking about here is that these resources help some of our most vulnerable constituents, including seniors and individuals with disabilities, particularly folks that are low income. Senator Casey's the chairman of the Senate Special Committee on Aging, so helping seniors and individuals with disabilities is one of his top priorities, and our personal office works very closely with our phenomenal Aging Committee staff. Much of that work is bipartisan, and I know Ramsey had mentioned at the top of the call that MIPA has been extended 12 times with bipartisan support. So hopefully I and the other presenters today have been able to highlight how critical this program is for all of our constituents. So with that, I will turn it back to Ramsey. Thank you.
Wonderful. Thank you, Lindsay. Really, really great examples and fabulous advice to all those listening in. Well, and now we have time to hear from those that are listening in. If you have questions you'd like to share, please go ahead and put those in the chat. We have a phenomenal panel here today. Scott, Jamie, and Lindsay are available for questions, so we welcome them. We're going to go ahead and get started with our first question. And the question is, why don't more low-income people on Medicare sign up for benefits they're eligible for? What are some of the challenges and barriers they face? Scott, do you mind kicking us off there?
Sure. I think the biggest reason that people don't sign up is they're not aware. We use the BIPA funding that we receive in Missouri to try to reach people where they are. If they're in rural areas, I can't reach them on Facebook with ads very often. Sometimes it's a technology issue. And so the MIPA funding helps fund us to go out to where we will encounter these individuals so that we can do presentations to them, or we can just do through counseling or through care coordinators at our AAAs and other agencies that we partner with. We can make that expertise and that additional information available so that they can be screened. And when you make it a part of your organizational structure to screen everyone, it's the best way to bring people in. And we don't have the marketing budget of some of the commercial folks out there, so it's really a challenge.
Laura, thank you. Jamie, I welcome your thoughts.
Sure. the same as Scott, but in addition to that, what we see a lot sometimes are people they might minimize their situation and their need. And sometimes they say, well, maybe somebody else needs it more than I do. And the thought of accessing this program is unfamiliar for them. Another thing that we see in our area is shortages with internet access, and they may not be able to get on and apply for these programs. If there are certain portals that they have to get on, there's an email access, and it's just, once again, they're not familiar with it, which is a lot of times where we can come in, we can walk them through the process. Right now, we're actually opening up access points that are more geared towards our rural areas, so we can meet people in person and walk them through these processes and screen them for eligibility and provide them more assistance.
Wonderful. And Lindsay, did you want to weigh in, given your perspective and vantage point?
Yeah, sure. And, it piggybacks off of what Jamie and Scott shared. How do you apply for something you don't know exists? Uh, that's what it comes down to. And we all know that Medicare is vast and sprawling and difficult. And if it's difficult for all of us who work on these issues, what about for the average layperson? So having these services is just critical so that people know what they may be eligible or it can actually help them to enroll. Going through that enrollment process, maintaining eligibility, all of those are barriers that we see for folks.
Can be real challenges, and having a helping hand to navigate it goes a long way. Looks like we have a question from Denise Weaver, who notes Denise enjoys working with the Mid-Alabama Area Agency on Aging. Fabulous. And Denise asks, what advice can you give for an elderly parent who needs care due to cancer? No long-term care insurance plan. Occasionally there are situations like this one, and one just came through this morning. What are your thoughts?
I know that in Missouri, we work with, even locally here in the middle of Missouri, Columbia, where I am, we work with several cancer practices where we provide counselors that go into their office and meet with patients and their families and talk about what those options are. And we say a lot that with Medicare, the answer to most questions is it depends, because it is sprawling, as Lindsay said. There's so many options, but by personalizing that service with the funding that we receive, we can provide the screening. We can come up to them and tell them the differences between this option and that option, which they don't necessarily know how to ask themselves.
And I think that's a great illustration, Scott, that the SHIPs, the Area Agencies on Aging, the Benefits Enrollment Centers are extremely resourceful in assessing the vast network of organizations that can be brought to bear, really positioned as leaders in collaboration and in partnership to make sure there are those efficient referrals when it comes to all things aging.
Yeah.
So wonderful. Please, Lindsay.
And I can just quickly add to, I'd also recommend reaching out to the local AAA. Sometimes they offer various things like respite services or caregiver programs. So it absolutely is worth touching base with them and seeing what they have available.
And as a AAA, yes, I second that, because somebody coming in that scenario, we absolutely are going to have them meet with our Medicare specialist, who boots on the ground are going to start talking about programs and services, but also link them with the family caregiver specialist on how to also support the caregiver and other LTC options.
Get connected to your state health insurance assistance program, to your area agency on aging, to your benefits enrollment center. Next question, how do you go about finding and enrolling beneficiaries that are particularly hard to reach, such as those in rural areas, those that don't speak English as a first language, those that don't have computer skills to complete an online application? What are some of your strategies?
So I think I want to reiterate what I had mentioned earlier is one of our focuses are opening access points. As I mentioned earlier, a lot of our towns and our coverage area is rural, and not everybody can come to our main office. And so we want to go to them, and we want to be in their community, and we want it to be an easier, accessible service where they can just go down the road and they can talk to our specialists, get a full screening, and talk about many of the services that they might not be aware of, and really wrap them around services, programs, and resources that they can tap into.
Wonderful. Thank you. Scott, did you want to weigh in there, or Lindsay?
Yeah, I think the way we work is pretty much through partnership, and Missouri's MIPA program is very much known for this. There are 3 different pieces of MIPA, if you will, different funded agencies. We have the AAAs, we have the ADRCs, the Disability Resource Centers, and then we have the SHIP, and all 3 are at different agencies, and Senior Medicare Patrol for that matter. We're all divided, but we work very regularly together, and we cross-refer very often. We do presentations on, in particular, the Aging and Disability Resource Center network to their existing network of caregivers, providers, healthcare providers, people who are case managers, and educate them about how we can fit in our piece of the puzzle. We also partner here locally with our area agency on aging in doing our benefits enrollment center project, which we also have. And one of the things that benefited our entire network about that is by teaching the rest of our SHIP program about programs like LINET that we didn't necessarily know as much about, or LIHEAP, I meant to say, pardon me, LIHEAP for utility assistance. And so learning about different options like that has been really helpful, and then sharing that across our networks. And that's what the SHIPs all try to do as a group.
And I'll just quickly add, one of the great powers of all of our offices is that we are able to bring together different resources, different groups, the power of converging. I mentioned when I was talking earlier, you can bring your local SHIP into a local Latino community center to talk about the services that they have. A couple months ago, I went on a road trip with a liaison from the FTC and the Pennsylvania Attorney General's office to some rural AAAs who gave fraud and scam presentations. So you can bring those various resources together. That's one of the powerful things that all of our offices can do.
So we have a few more questions from the audience. Love it. So Teague Morris asks, is there a generic form for applying to the Medicare Savings Plan? That is a form that isn't designated or instituted via the state's Department of Health and Human Services. A generic form.
We wish we had one.
There you
Because of
go.
the state involvement in Medicaid, that's where the rub comes in with that process. It is a bit of daunting when you're moving from state to state.
Thank you. So our last question, how do you find your local area agency on aging?
Oh, I was gonna say, Scott, I saw him unmute at the same time. Really, our website, eAAA.org, and we encourage people to go, and it lists all of our programs. People can access us. They can do a secure referral, and providers who want to make sure that that information that's being sent over is doing so safely. But they can also email us and get sent right to the Aging and Disability Resource Center specialist, and it goes right to us, and we can certainly address those questions as quickly as possible.
I'll say for the SHIP programs, which also work with AAAs across the state, we have 10 AAAs in Missouri. We have a national network that is operated by the SHIP TA Center. So you can go to shiphelp.org, shiphelp.org, or call their 800 number to be routed to the SHIP in your state. So that's another way to access these services.
Excellent. And for those that want to learn more about the various programs, services, and supports that are available, 2 other opportunities to learn more would be Elder Care Locator and benefitscheckup.org. 2 additional opportunities to learn more, to get connected. But I want to thank all of our fabulous panelists today for their remarks and for their examples and for their guidance. We have some valuable resources for you over here on the slide, so that you can take those websites down if you want to learn more and get connected locally. And we'll follow up after the webinar with these links and more background information as well. But thank you all for joining. We hope you got a good sense today of how vital this work is, why it matters to so many. As I mentioned at Open, this work has connected 9.3 million low-income individuals to benefits in the last 2 years alone, truly providing a lifeline to so very many. But as our population ages, we know that's just a fraction of those that need support. Today, 20.5 million Medicare beneficiaries are navigating enrollment and trying to stretch their limited income to ensure their health security, and living at an income at or below 150% of the federal poverty level. These individuals need help affording their health care. We know that benefits outreach and enrollment works, and we know that people support it. In a survey we conducted just earlier this year, we found that 94% of women, including 92% of Republican women, told us they support strengthening Medicare efforts to help individuals that are low income get connected to and sign up for benefits they're eligible for, but yet not yet receiving. So last year, 75 national aging, disability, patient, and provider groups signed on to a letter to Congress supporting extended federal funding. But as I mentioned earlier, the federal funding for this work will run out soon. It was extended 12 times with bipartisan support over the last 16 years, but this funding will expire on December 31st. We believe it's time for Congress to make this important funding permanent. Stable funding will provide security for staff and professionals within the network who are working hard every day to find and enroll people in need and serve your constituents. Constituents like Shirley, who needed not only benefits programs, but also in-person assistance to apply and enroll, and what a difference they made. Without her local benefit enrollment center, Shirley told us she may have ended up living in her car. All this after a lifelong career in saving, doing the right thing. We owe it to people like Shirley to have their back, to get it right, to provide the support when it's needed. This funding is critical to make sure Shirley and so many others like her can age with the dignity they deserve. Thank you so very much for joining us today and for your commitment to ensuring these services are available to all. Thank you, and have a great rest of your day.